Good. Are we ready, Missy? Are we ready? All right. Charlize, are we good to go?
Yes.
All right. Good afternoon, everyone. I'd like to welcome you to the September 26th Community and Provider Forum. My name is Winslow Woodland. I am the Deputy Director for the Developmental Disabilities Administration, and I will be sitting in for Director Andrew Reese. And we have a rather packed agenda, albeit two presenters. Today we'll have a community listening forum for the FY 2027 and 2031 Developmental Disability Council's state plan, presented to you by Allison White and Kaylee Wasenko. And following that, we will have a presentation of our national core indicators data by Angela Turner from the Department of Disability Services Quality Assurance and Performance Management Administration. We currently have about 100 attendees. I'd like to welcome you. And without further ado, I will turn it over to Allison and Kaylee.
Hi, everyone.
Hi.
This is Allison White.
And
give me a
Kaylee
second
Wasenko.
I'm getting my screen together. Hold on. Okay. So we are here, as Winslow said, to listen to all of you and get your thoughts on some questions that we have about folks with developmental disabilities and their families in DC and what people need to live their best life. And we are doing this in preparation for our next 5-year state plan, which is the plan that we put together that has all of the goals and activities that we want to do over the next 5 years. So we want to make sure that those activities and goals are responsive to what our community needs. So again, I am Allison White. I'm the Executive Director of the DC Developmental Disabilities Council, and I am happy to be joined here today by Kaylee. Kaylee, go ahead and you could do a quick intro.
Sure, thank you. Thanks for having us. My name is Kaylee Wasenko, and I'm a community member, and I'm also a sibling to a man with developmental disabilities.
All right, and I think I'd be better at this by now. I've got 2 screens trying to make sure I have everything on each of them. I know we have a couple of our council members here today also, so happy to see some of you, and the DD Council staff is here as well. And I also want to thank Winslow and Andy and the whole planning committee that puts these meetings together, and Charlisa for all of the work in the background that you're doing, and the interpreters as well. Appreciate you. So this is our DD Council mission. This is why we're here, why we're doing this. So the DD Council works to strengthen the voice and presence of people with developmental disabilities and their families in DC, supporting greater independence, inclusion, empowerment, and the pursuit of life as they choose. We work to eliminate discrimination and remove barriers to achieve full inclusion, diversity, and equity through our advocacy. We really want to hear from everybody what you think would help people with DD and their families live the life that they want to live. Your ideas, your thoughts are going to help us decide where we want to focus our time our efforts as staff members and as DD council members and our funding over the next 5 years. And we're here to serve you. We appreciate what everybody has to share. And we have some group agreements to hopefully create the space that, create some space that will facilitate everyone sharing in the best way that they can. So all ideas are considered here. This is really a space to share what you're comfortable sharing. There's not a right or wrong answer to these questions. Don't share personal information or stories of other people as here or after the meeting ends. So we're all here to learn together and to hear from each other, but we don't want to share other people's business. We all deserve respect and a chance to be heard. So whether that is you coming off mute because you want to share something verbally or you put something in the chat, we want to hear what you have to say. Share honestly and only what you're comfortable sharing. We're grateful to have most of the hour here to talk with everybody, but we are going to try to keep it tight and move through these questions. So if we move past something, you still have something you want to say, please feel free to use the chat. We're also going to share our personal information or our maybe not our personal, our email addresses and phone number, and encourage you to share afterward as well. Again, there's no right or wrong answer. And while the session is recorded and people will be taking notes, all of the comments and information we're gathering will be kept anonymously. So we're not going to come back and say, oh, Winslow said XYZ. It's not going to be attributed to any specific person. And I am happy to pass it over to Kaylee to get us started with the questions.
Yeah, thanks, Allison. We'll have 5 questions. Some of them will include a polling element. So you'll see a pop-up on your screen, and then you might be able to add extra to the chat or conversation. We have note takers taking it, so whatever you feel comfortable with. And with that, I'm going to get started. So question 1, it starts with a poll, so get ready. And the question is, you have $100 to spend in ways that support people with developmental disabilities. You can divide this $100 however you want it. We want to know what is going to be most important to you. What is the best use of this money? And you're going to get a poll, and we ask you maybe to select your top 3. If you want all in on one area, that's totally fine too. But I'm asking about what are like the top 3 areas. How would you spend that $100 to support people with developmental disabilities? And perfect timing. So with that, I'm going to pause and give you a few minutes to submit some answers. Oh, and I'll read the options out loud for you. Education and early intervention, employment, health and safety, housing, transportation, self-advocacy, services and supports, transition from school to adulthood, and supporting interpersonal relationships like friends, lovers, coworkers, any kind of personal relationship. And Allison, I cannot see responses yet. So maybe if you could help me out, I think you might, as co-host, might have options. So there's no rush for people, but I'm just letting you know, if you could help me know when we seems like we've got most of the answers. Thank you.
So I will have to manually end the poll whenever you guys want to be done. I don't know how long you want to give people to answer.
Oh,
it
thank
says
you.
we've received about 58 out of the 124 people. So
Okay.
just let me know when you would like me to close it.
Oh, thank you. Give it 2 or 3 more minutes then.
I think some people are still joining also. So if folks have just hopped in, we're doing a poll on this question of, well, maybe you could repeat the question, Kaylee, for folks that maybe have come in the middle.
Yeah, of course. You have $100 to spend as you'd like in the following areas that support people with developmental disabilities. You may divide the funds in any way that works best for you or your family or how you would want to spend the money. We're suggesting selecting your top 3. But if you want to spend $100 in one area, that's fine too. So divide it up as how would you spend that $100 to support people with developmental disabilities?
We've got 69 out of 126.
Okay.
Oh, it's still going up though.
Okay.
Maybe another minute. People can finish it up.
Depending on people's devices, everyone may not respond. The poll has been open for about 4 minutes now.
Okay. If it's okay, let's go ahead. We'll close it. And you can also be part of the conversation or add notes in the chat. That would be great. Okay, cool. So can everybody see this now? The polling results, hopefully. What do we got? Ooh, housing is a big one, 48%. Services and supports, 49%. And health and safety, those seem to be the top. Health and safety, services and supports, housing, health and safety. Great. Now I'm going to open it up for a few minutes. Again, you may use the chat or you can unmute yourself. I want to talk a little bit about why you selected what you did and what you think, how do you think the money could be spent in those areas? That's really our question too. So if we could pop up, yeah, we're just expanding. So now that we've identified our priorities, what are ways that people with developmental disabilities can be supported in those topics? And I'm going to open it up. Please unmute yourself or utilize the chat. Let's see. There is a comment, be helpful to provide examples of services and supports. And I think that's a great comment. And for those who voted for services and supports, I'd love to hear why and how you envisioned what services and supports came to your mind. Somebody wrote, is there an opportunity for transportation to and from non-medical appointments? That's key. I like to go out and meet with friends or family or have non-medical meetings. Housing, health, and safety education. We've got a big group. Nobody wants to nobody wants to talk about why they selected what they did.
Hi, good afternoon. I'll speak up. This is Ernest with Community Multi-Services. I think relationships is a priority when persons that we support or know that we trust, like, and love them, then that goes a long way. And even where our staff and or family is concerned. So that's one of the reasons I chose that.
Thank you, Ernest. Mm. Donna in the chat wrote, with only $100, health and safety gives me more bang for my buck. I think of health and safety as cleaning supplies, hygiene, products. Prices are so high now, the funds provided by HCA is too low. I have a fear of failing, and where would my child live? Services and support seems to encompass all of the categories listed. I'm hesitant to provide a specific on services and supports because I want to hear what's on your mind. So I think that's really good feedback, that topic is not very specific. It'd be helpful to know more. But I'm going to intentionally leave it and hear how you like to interpret services and supports. Transportation is always a key. Services and supports are essential as it makes life easier. Medical appointments. I chose employment, housing, and transition from school to adulthood because that time period is critical for setting up students for long-term success by providing them with a stable place to live that meets their needs and a fulfilling and self-sustaining career. This is me reading the chat box, by the way. But please, Ernest was brave. I appreciate that. Somebody else, please feel free to speak up. What's on your mind?
Okay, I'll say something.
Mhm.
I say the reason why I picked transportation is how are you going to get everyone to one place or another? Because I have an issue with Metro and Metro access as well.
Can you tell us about that? What issues do you have?
I'm gonna say finding where place to go and almost getting lost, and that's all.
Mhm. Thank you. Yeah. A couple other chat comments. Support such as a wheelchair, bed, and other adaptive equipments need funding assistance. Another comment, it seems that young people get dropped off and forgotten when they get out of school. I think employment would be great as it develops a fundamental sense of purpose, duty, and responsibility to the person's community and fosters independence in the long run, in my opinion. I see people liking comments and agreeing. I appreciate that. Identifying and securing affordable housing in safe and thriving communities. Okay. Any last comments? Anybody else want to speak up or drop comments into the chat box? Going once? Okay. All right. With that, if you have others, you can put it in the chat box. We'll be able to capture it later. I liked that there's kind of a mix going on. I'm going to move to question number 3. Oh, I'm sorry, one last. Employment empowers people to have income and that supports their wants, dreams, and help people to become self-sufficient. Housing is critical for all people so that we feel safe, secure, and independent. Services and supports I chose because I thought that though that encompassed several areas. I do believe that relationships are also critical to a full life. Thank you, Monique. Okay, let's take this a step further. Think about the services that you use now or that people in your circle with developmental disabilities use that are most beneficial. Do you have concerns about how these services might change in the next 2 to 5 years? If so, what concerns you? Tell us more. Funding cuts to services. Biggest concern is funding cuts to services. What services in particular are you most worried about being cut? Healthcare would be a huge concern. Access to healthcare, housing, and employment. These are all coming from the chat. Yeah, I see some likes. Nutrition, dietary cuts, concerns. Yes, funds and resources are being cut and it might affect some people. Anything specific? I'm hearing healthcare, access to healthcare, housing, employment, nutrition, medical supplies. Seems like healthcare, things related to health, cuts in that area. Library services for people we serve. Budget cuts concern me. Holidays and recreation. What concerns do we have about that? I feel that my loved one is losing his physical and mental mobility. Education cuts. It's another chat box comment. See a like for that. Another comment. I'm concerned that the newest service, assistive technology, will be taken and that new services won't get a chance due to budget cuts. So new programs, new services, not even having a chance to kind of get off the ground because of budget cuts. Yes, seems like there's a lot of agreement for that, a lot of concern for that. So I'm hearing it just to kind of recap some of that health, things related to health, healthcare. Somebody had mentioned medical supplies for the last question, and nutrition. I feel like there are comments about transportation too, like beyond just medical appointments. There's a lot of discussion about that. Concerns about sorry, excuse me, before I read that, education cuts or like maybe new programs, library services, things that could potentially cut before they even have a chance to grow and really see their potential. So, okay, somebody has a question. What education programs are available for after high school? Oh, this is good. I want to open this up too, because somebody else mentioned that, after you graduate, what is going on there? So needs after high school graduation and knowing what programs are available. Excuse me. I'm gonna make a note too, if there's a specific question. If somebody, feel free if somebody has a good answer, or we can, excuse me, we can try to follow up and get some resources too. So we'll make a note of that, please. Assistive technology is not a new service. The remote delivery of assistive technology through telehealth is new in the 2025 IFS waiver renewal and the 2026 IDD waiver amendment. I just want to ensure there's no confusion regarding AT services. Thank you.
Hey, Kaylee, this is Andy. I
Mhm.
raised my hand, but I think with the slides, you probably
Oh,
can't see it. That's
I'm
okay.
sorry, I cannot. Yeah,
Right.
go ahead.
No, I just wanted to say the question someone had about education after high school. It's important for people to be connected with RSA so that if they're interested in, so that they can identify what their career goals and interests are, and then whatever education is necessary to achieve that career goal can be provided by RSA. So it's very important to talk about in the context of employment, the support people can get from RSA to achieve those employment goals, which also could include education or other training.
Thank you for that. And then another comment concerned that the administration is making changes to services without considering the long-term effects to the people that need them to live. Yes, and please, just to reiterate, I unfortunately, I did not see Andy's hand raised. So if you have a comment, just unmute yourself. Go ahead, share it. Okay. All right, it seems to be winding down. So with that, if there are no more, if you have something else, you can, if you have concerns, you can always put that into the chat box. But I'm going to move to question 4. I'm going to pop it back over to Allison. Thank you.
Thank you, Kaylee. And thanks everybody for what you've shared so far. Really helpful thoughts, good ideas. So,
Oh, Allison,
question-
I'm sorry. Before we start,
Yeah.
would you like me to read the chat for you? Can you see that with you sharing your screen?
Thank you for offering that. I can see it. I have 2 screens, so I set it up so that I can see both of them. I
Perfect.
appreciate that.
Okay.
So question 4, what can the DC Developmental Disabilities Council, that's us, what can we do so that people of all races, so I'll say all racial and ethnic groups, all different cultures that live within DC, have access to quality services and can live their best lives? So this is an overarching question, really trying to think about how do we make sure that we're serving everyone who lives here in DC? We live in a very diverse area, and that is a beautiful thing. And we want to make sure that we're reaching everyone. So what can we do so that people of all racial groups have access to quality services to live their best lives? And I'll also add to this that sometimes it's hard to know what the solution is. It's hard to answer the question, what can we do? We might know that there's a problem somewhere, that some group isn't being served very well, and we might not know why exactly. So we don't know how to solve it if we don't know why. So even raising what you think might not be going well, or we might not be serving all racial groups equally. Even if you don't have a solution for that, raising that can be helpful here. So feel free to share that as well. So we've got a couple comments. I'll lift this one up from Matt McCullough. Excellent job, Kaylee. I echo that. We have advocate, question mark, question mark, question mark, through advocacy and support when people's rights are violated. Research and advocacy. Thank you for those. Educate on services available through outreach events. So doing outreach broadly to provide that education on services. Today is the first time I'm hearing about this organization and I'm not sure what you do. So getting out there, making yourself noticeable. Thank you for that feedback. Definitely getting out there. Stay connected with community groups serving a variety of ethnic and racial populations to stay aware of unique needs of unique populations and then advocate for the variety of needs. Thank you. Most communities have a center of sorts for resources. Reach out to them. Thank you. Yeah, those are uniquely connected comments too. Connecting with the people who are already connected. Continue to create opportunities for public engagement. Expand cultural events to communities. Ensure that their likes and dislikes are met as it relates to their background and whatever it might be, and advocate in those areas. Focus on systematic change, capacity building, and advocacy. Partnership with communities. So I don't know if somebody was reading the DD Act, but systems change, capacity building, and advocacy is exactly written in the law that authorizes our organization. So definitely you're right on with making sure that we're staying connected to the roots of what our charge is. Partnering with local organizations for outreach. Some back and forth about the AT services. Yep. So something maybe I'm reading into this, but about the AT service, Bernatrice is saying it's not a new service. It's been around, but for some people, it might be new to them, or maybe they hadn't heard of it before or didn't understand it before. So that speaks again to the importance of information sharing and continuing to get the word out to all groups of people about what's available. Feedback and data. Agreed. Thank you, Bernatrice.
What kind of data is useful to collect in this area? What would be markers to know if we are being effective in helping to move the needle so that people of all races can have access to quality services?
A good question. Data from surveys about people's opinion. We might come back to this idea about data with the presentation after us about national core indicators. Keep this in mind when that presentation is happening. Maybe there are some questions about what's in that data that we could learn from about race and ethnicity. Why is it an overrated concern when it comes to AT devices such as OrCam, Meta glasses, or C-Pen? I'm not sure. Maybe you could say more about that. I'm not sure what that question is related to. Maybe it's about how AT services are authorized and some of the questions about how that process works. I'm not sure. Feel free to add more to that comment. Demographic information in DC compared to DDS's population and whether groups are missing in response to the data question. Anything else on this question about how do we ensure all racial groups in DC have access to quality services to live their best lives? I might even add to quality services and supports. We can think of formal and informal services and supports. Formal services being like what DDS, what the Department on Disability Services offers. Informal supports can mean many, many things. Data about knowledge gaps that exist within the disability community. Thank you. Anybody want to come off mute and let us hear your voice? Okay, I think the answer was no. I can take a hint. I'm going to move on to question number 5 here. And we have another poll for this, so I'll read the question first. So this is kind of a we're doing a visualization here. So imagine a confident, successful self-advocate. Confident, successful self-advocate. They are carrying a backpack with all of the training, all of the tools, all of the experiences and characteristics that make them confident and successful. So this is like a theoretical backpack here. What kinds of trainings or tools or experiences do you think they have in that backpack? And we have some, we have a poll for this. So thank you, Charlisa. So I'll read some of the options we have here, and there's an other as well. So if some things immediately came to mind and they're not on this list, then we want to hear about that too. So some of the options that have come up: being a member of an advocacy group, early leadership opportunities, mentorship from other self-advocates, knowing how to ask for what I need, help from people who understand me and my culture, supporting friends and family, practice talking to elected leaders about issues important to me. So practice like giving things like testimony, opportunities to teach other people with disabilities about their rights, taking control of what services I receive and how to get them, participation in social justice movements, seeing other people with disabilities as leaders, improving my leadership, improving my leadership and advocacy skills, or that other, if you have other ideas about what belongs in that backpack to make somebody a confident, successful advocate, please put that in the chat. All right, we've got responses rolling in. Thank you, everyone. If you haven't responded yet, keep sharing your thoughts in that poll. Give you another 15, 20 seconds.
I love these comments coming into the chat.
Amazing.
Yeah.
In the chat, we've got patience. The amount of time and effort to fill gaps in knowledge related to disabilities is exhausting. Patience, yeah.
Mhm.
Supporting friends and family. Being
like it.
recognized by several communities, not just family.
Mhm.
Was someone saying something? Was that you, Kaylee?
Yeah, just acknowledging Donna's comment. I don't think that's one that I've heard in a listening session, this idea of being recognized by several communities and building relationships in the community of your choosing. Mary mentioned equality. So important.
Amazing. I think we can close the poll. Thank you, Charlisa. When speaking to policymakers, bottom line up front, helping people learn that. All right, great. So we've got, looks like knowing how to ask for what I need is the top response. Oh my goodness. That is so hard, right? That really does take practice and time. Some other high scoring options, help from people who understand me and my culture. About half the folks said that. Supporting friends and family. Oh, there's an even higher one. I had to scroll down. Taking control of what services I receive and how to get them. Yeah, definitely related to knowing how to ask for what I need. Seeing people with disabilities as leaders, improving my leadership and advocacy skills. Being a member of an advocacy group. Yeah, these are all really, really helpful to see where folks are ranking these. One of the things we want to do is get a sense of what are these things that help people be confident, successful self-advocates, and then look around DC and see where are these opportunities being provided and where are the gaps in that? Where can the DD Council contribute to helping people get these skills and tools and experiences that isn't happening anywhere else, or that we could improve upon in some way or support. Does anyone want to speak up and say anything else about this question? All right, well, as always, feel free to keep using the chat. Let's do a quick summary. Kaylee, I'll toss it over to you just to kind of summarize some of the things you heard, and then I'll go.
Thank you. Yeah. Well, there were earlier in a discussion issues around healthcare and concerned about how that might change. I've heard multiple comments about transportation, not just getting to medical appointments, getting out and being a part of the community and going to other places and doing other things. And that ties with some of the comments of connecting with other communities, being involved. And I like partnering with local outreach organizations, some really good ideas about how we can promote equality. And for me, the theme that I see in that is making sure that we are respectfully introducing ourselves to other communities and cultures and being aware of that and knowing what are the key organizations and offices that offer support and doing the work to build respectful information. There was some good feedback of different types of data that we can use. Things about filling the gaps in knowledge. A lot of great feedback today. This is excellent. Yeah, I think if there are any other big themes, please speak up. But I appreciate not only the brave souls who spoke, but also utilizing the chat. There's such good information here, so this will help us a lot. Go back and make our plan about what we're going to do for the next 5 years. And I've made note of the comment too of people just learning about us for the first time, because it seems like our pushing what we're doing and making that known should be part of our plan too. So thank you for that.
Awesome. Yeah, I totally agree on that. Um, being known is important. One of my measures of success for our work with the DD Council is when we have an event or an activity, I'm always looking for the list of names and how many people do I not know on this list? Like the greater the number of people that I don't know, the better. We really want to be connecting with more and more folks. I think overall, I also heard a theme of belonging and being known in your community, feeling like you belong, and having the relationships that help each of us feel fulfilled and feel safe. So, thank you all for some of that feedback. And just another quick comment. One of the things that I always think of that always comes back to my mind is that safety, when we think of safety and being safe when you're out and about or staying safe at home, I think one of the number one things that creates safety is relationships, having relationships with people who know you and they're looking out for you. And they would notice if you weren't there, and they'd come looking for you to make sure you're okay. So we also have a survey if anyone prefers to, and even if you don't, this survey is for everybody, but some folks might prefer to give feedback in the survey. We encourage everyone to take this. We have it in English, Amharic, and Spanish. You can scan these QR codes with your phone, or Luce put the links to the surveys in the chat. So you can just link right from the chat to the survey. It takes about 10 to 15 minutes. So we really appreciate that feedback. It helps us quantify, kind of see numbers wise where some of the biggest concerns are that we can address. We always want to express our gratitude to everybody that we work with. We don't do this work in a bubble. We don't do this by ourselves. We are stronger together with a lot of you here on this call. This slide has a lot of organizations we work with regularly. Centronia, the Ethiopian Eritrean Special Needs Community, our DD Network partners, which is Disability Rights DC and Georgetown University Center for Excellence in Developmental Disabilities, Quality Trust, School Talk, Project Action, Advocates for Justice and Education, the Linner Foundation. Oliver, I know you're here, and our government partners, Office of Disability Rights, DDS, and then some of our other communities of practice that are part of this work. Family Support Council, Supporting Families Community of Practice, and the DD Council State Plan Committee. Huge shout out to the State Plan Committee. This is really a working committee. The DD Council members are volunteers, and this committee is made up of volunteers who do this hard work because they really care about it and believe that it's important. And this is a great example of how a committee should work. And Luce is our DD Council staff, who's the liaison with that committee, does really great work with that. So I am personally very grateful to all of the members of our State Plan Committee.
And Director Reese is a part of that. I just want to give him a shout out too. He's here, so we
Yeah.
appreciate the time. But yeah, it is a working committee, and I know there's some DD council members. There are people here today who are all putting in effort, and that includes Director Reese. So thank you for that.
Absolutely. And I also know Director Reese is on vacation right now, and still joining this. So there's huge dedication there. Another quick survey. This is just gathering feedback about what you thought about this forum. How did you think this listening forum went? Was this a good forum for you? Was it something that worked for you, or do you have thoughts about how we could do these kinds of sessions differently? Would definitely love that kind of feedback as well. We are, our next 5-year state plan begins in fiscal year 27, which is almost exactly a year from now. So we still have a year to be creating this plan. So there will be some more ways that we're gathering information from the community. And then once we have a draft plan put together, that'll be another opportunity for everybody to have something to react to, even like, here's what we heard. Here are some of the goals and activities we want to do based on what we heard. Did we get it right? Is this, we want to hear that kind of feedback, and that'll come out next spring-ish. And yeah, thank you so much, everybody. I'll put my contact information in the chat as well. So really appreciate this time, and thank you so much, Kaylee, for co-facilitating this with me. It's been great.
Yeah, it's a good group. I appreciate everyone using the chat and speaking up. There's got some great ideas. So thank you. This is very helpful for us. It really is. We appreciate it.
We would like to also thank you here at DDS for your providing the opportunity for people to weigh in and participate today. Thank you very much, Allison and Kaylee. At this time, we will have the presentation on the National Core Indicators by Angela Turner from the Quality Assurance and Performance Management Administration for the Department of Disability Services. And I see Allison has included her contact information in the chat for those who would like it. Hi, Angela. You have the floor.
Hi, y'all. Thank you for having me today. I am going to make sure that I give this information to you in a way that gets us all out of here on time, but also gives you as much information as I can, but still also giving you the link so that you can access the fuller reports yourself. So I know I came to you guys last year to talk about the 22-23 data results. This year, we have the opportunity to compare, see where we've come, see what improvements we've made, look back and see what we did to improve, look to see if there are any new target areas that we might want to improve in, and also what is the community telling us as an agency and also as in the provider community. So I'm going to give an overview of the 22-23 data. I'll show some comparisons from the 22-23 data to the 23-24 data, and some takeaways and some things we can think about, and possibly some opportunity zones for space for conversation, more dialogue about how we can improve, how we can connect to the community a little better. So hopefully you all get a lot from it. So I'm going to turn my video off while I present and share my screen. Not sure what you all can see. There we go. Are you able to see the PowerPoint?
Not yet, Angie.
Not yet. Oh, sorry. I think I have to hit that button down there. Come on now. Now?
It's loading, but it isn't visual just yet. Yeah, we can see.
There we go. Now we're back. All right. So again, we are going to be looking at the 23-24 data. I think I told you all last time when we do that, we look at the years before. So the year prior. Next year, we will be able to present not only the comparison from 22-23, but from 24, and then the year after that, 25. So by 27, I'll say we'll have 4 years worth of data, and that's a great place to be. It's a really great place to be as far as change goes. So looking at how we did, or what was going on with the NCI indicators for 23-24, in total for in-person, there were 17,585 respondents out of 30 states, including our city. And for us, again, it is 18 years of age or older, and people who receive at least one paid service in addition to service coordination. For the adult family surveys, as you remember, we participate in the 3 in-person surveys, which are face-to-face, and adult family surveys, which are mailed or online entries for families living with adults receiving at least one service, in addition to case management. 13 states participated in this, including our big city. So why is it important? One of the ways we try to stress the importance of NCI is through at folks' ISP meetings, and through family interaction, and in places like these, forums like these. We use it to support achieving performance goals here at DDS, identifying areas of improvement, as I said, helps us assess how supports are impacting the lives of the families receiving services. And one of the biggest ones that I know some folks are looking forward to, informing future policy and procedure changes. Demographics and kind of the makeup of the participants for the 23-24 survey. We had 390 valid surveys. We this past year, 2024-25, we had 442 people participate. And that data, like I said, that data is going to come out very soon, and we'll talk about it. If you look, we are above the national average for valid responses in Section 1, which are the direct responses from the people who participate. And 92, we're slightly, just a smidge below for Section 2, which is the prox. That is where people can get support from somebody that they trust or comfortable speaking on their behalf. Our makeup as far as who we are in the city looks pretty much the same as last year. Average age has gone down. The youngest being 19, oldest being 85, but our average is 52. National average 43. Our demographics as far as gender kind of remain the same, still above in certain areas, but the makeup is just about the same. Looking at the homes in which people live in, natural homes, meaning they're a home that they own themselves or are leased to, or a home that they live with a family member, cousin, aunt, niece, nephew, natural supports, as we like to call it. So for the blue, you'll see that's the national average. And for DC, that's the green. We are above in supported living and res have. There was an uptick in the amount of respondents that participated in the survey that live in their own home. So that was interesting to see. Supported living also had an increase, but it also is, you'll see next year that the numbers are getting even higher for those who live out in the community in their own home that want to participate in this survey. Excuse me for one of these things here, but ICF is at 0% for the national average. DC, we're above that, so you see, and res have, we are below in that area. So what are some takeaways and opportunities for us when it comes down to looking at the makeup of the group of people who participate in the survey? There are a couple of things I definitely have to note that I know you all see, those huge changes, right? The red, of course, are where we've had declines, and the black are what we have in the change section that were increases. Some of them are very high. Some of them might look a little weird. just because of how high they are. But it speaks to our improvement in record keeping as well. We had between 22 to 23 and 23 to 24, we had more responses in 23-24 that were considered valid. In 22-23, we did not have as many responses in those larger with those areas where you see a large change. So also to note that our sample size has increased, and what did it say? A couple of things I wanted to point out. The percentage of married people participating dropped. That tells me that maybe where our sample isn't becoming as diverse as we would like, because we want to hear from everybody, of course. But we want to hear from everybody from different walks of life. So maybe that's a target area for us on how we present NCI, how we get people involved, and even how you all can help people understand what NCI is and also get involved in. So looking at employment, a lot of things to discuss, internal and external, right? So you can see 16% of the respondents reported that they participated in competitive employment. That's having a job out in the community, a paid job. And these percentages you see below that are people who, that's where the type of residence the person live, the people live in that work in competitive employment. Heavy coming from, again, natural homes. That's people who own their home or live with a parent or guardian. Host home is pretty high this year. And group setting also is bit consistent from last year. You'll see the types of jobs have gone on retail, highest being other. Other means other could be a job that didn't fit into these categories. And which also could say, are we expanding our creativity in how we're helping people get jobs? Or are we getting into different agencies? But that area is for jobs that aren't pretty clear to retail, building, food prep, food service in general. It's not surprising that the third highest would be building and ground cleaning and maintenance. And the second highest being retail. What are some takeaways from the data in employment? More people are reporting having jobs in the community, even though it's a slight increase. We'd love to see that number go up. A larger percent of people want jobs but are unemployed, but that could suggest a gap in between interest and opportunity. Are people are telling us that they want a job? Are we exposing them to different industries? Are we helping them are we helping them get connected to the community, or even something as simple as applying for different jobs outside of what we may feel like is a place that might be easier for a person with a disability to get a job? But that should not stop us from encouraging people and exposing people to so many different employment opportunities. One of the areas that we changed in a negative way from one year to the next is how people spend their time out in the community in relation to areas where they feel they're getting any skill building. So fewer people were reported participating in job training and skill building, with the highest being in schools and classes. Now, something to always remember when reading these things, it is the sample size. It is the amount of people that respond. So we look at how close they are from one year to the next. If there's a huge jump, of course, we're going to look at how many people responded versus how many people didn't, and where that lands is percentage, because it might not actually be a true negative. But these areas pretty much fall in line with the way the data looked from 22 to 23. So looking at community inclusion and access, taking note of a couple of things. Where we are above the national average, people having access to the internet, people using technology in everyday life to help do more things they do on their own, using telehealth for health professionals. Ooh, I repeated that. But we're going to see a little bit later some numbers in tech that could say that, yes, there's increased use. However, there's a lot of people don't really care for it too much, report that they don't care for it too much. And that could really just mean that there might be a lack of knowledge in how to use it. Transportation and being able to get out and having access to things has increased, even though we may be below the national average in some areas, but people do feel like they can get out when they need to and when they want to, and they feel supported in getting out. Couple of things to note, like I said, the access services and supports used for video conference technology. That one is, to me, an opportunity where we see that people know about it, but do they actually access it? Our services are expanding, so that might be a section or area that internally in your own organizations and at home, looking at where can we add with the conversations we're having with people about the ways they can best support themselves in their home independently. A couple of things to note too, again, that the sample size was a bit higher this year for remote supports especially. So there's a big, huge difference in our remote support numbers. But again, that is an increase in the amount of people who are reporting. It also speaks to our ability, our transparency, because one of the things I've noticed in our data too is that there are less. They were for 24, 25, 23, 20, I'm sorry, excuse me, 23, 24, there were less areas where we were unable to identify or unable to code those responses. So we were able to get it. So that speaks to some improvements in our ability to be transparent in our data collection. But from this, some takeaways: people continue to feel supported in transportation, internet, and access. Last year, we talked about where even in the family surveys, we'll talk later in the slides, that people from families reported that they have everything. They feel like they got everything at a touch at their hands, but do they feel competent in using it? Do they feel supported? Access to the community remains steady, still low. Going out to restaurants and coffee shops happens more often than activities like shopping, entertainment, and inclusion. Now, we all, we live and move around in the community, so we see and we know a lot of things that happen. We would love to see, or even see we would love to see possibly more exposure into other and more creative activities outside of just going to restaurants and coffee shops. I enjoy those myself. However, there's a big, huge world out there that we need to take advantage of. People feel included. 100% of the responses we receive say that they feel like they feel themselves in groups, which is great. Slight drop in being able to go out with preferred folks that they want to go out, be it somebody in the home, staff, friends or family, girlfriends, boyfriends, best friends. Participation in groups remain consistent, and the use of video conferencing has dropped. Looking at choice and decision making, here's where we are. 28% chose where they live or reported that they were able to choose where they live, and 23% said they had some input. We still remain high in the area where somebody says that people reported that somebody else chose that where they live. 38% choosing who they live with, and 17% having some input. To me, these are like opportunity zones, not just for the agency, but for the provider community and even the community itself when it comes into being able to make choices. How can we improve that number where you do have input and decrease that number where somebody else chooses, if you're supported in that decision. Remember, these are responses from the people who are receiving services and possibly somebody that helps them in their home as a proxy. So it's one thing to know what we actually do or feel like you do, but then there's another to actually hear it from the community. That's why this is important. Looking at some of the rights and respects area, 96% reported there are no rules about using the phone, and 16% said there are rules about having friends and having there are rules about having friends and visitors. Some can stay home. We are above the national average for people being able to stay home, which does speak to our ability to support people in being as independent, the provider and the community and the agency. Others, we look at certain levels of respect, and you'll see a little bit here, where people feel like they are in their home and it is their home, right? Some takeaways from there: support for daily decisions remains strong. There's a decline in voting opportunity and being notified before entering rooms, and that may be a target for attention, right? That might be something we need to discuss. How are we talking about voting opportunities? We have the midterms coming up. People really, I'm 100% sure people would like to, but may not really know how to. So how are we talking about voting? Is it just annual? Are we talking about it quarterly? Casual conversations? Rules about visitors have decreased, which means more social freedom. However, that's got to continue to go down, right? People do have the right to have visitors in their home. They do have the right to connect with people that they meet, say at work, at their day program, their neighbors. So we need to support and how best we can help people feel like that's something that everybody can do in their home, that they can do it as well. Looking at relationships and satisfaction, we are above the national average for folks who feel like they can meet friends when they want, below in people wanting to help make new friends. So people may feel more confident and more, what's the word? Not confident. Yeah, confident. 9% often feel lonely. That is a decrease, which is a good sign for us too. People feel like they are connected. They have friends. Maybe we are doing better with how we are connecting folks with people who have and people who do not have disabilities for more inclusive, for more community inclusion. So this is our comparison from 22 to 23 and 23 to 24. Areas of decline, like I said, used telehealth services, and the largest declines being wanting help for making friends, which is not a negative, and wanting to live somewhere else. So some takeaways: less loneliness, more communication with friends and family, fewer people wanting to move, more interest in community involvement. Most people have friends and can meet them out in person, which is great. Fewer people want help with, more slight increases in having best friends when asked if they have a best friend. And the question for potential romantic connections was, do you feel like you can date? Do you feel like you can get married one day? And people are feeling that way, which speaks to how we are now, our improvement in being able to include or helping people with connection and relationship. So service coordination and workforce, we are above the national average for people who reported that they talked to their service coordinator about tech, which is great. Now, if we have an increase in that area, but a decrease in the amount of how much people use it, there's an opportunity there, right? We are below the national average for people helping make their service plan. And that is one of those areas that gets cited or identified in our HCBS settings area of quality measures for NCI, which has that is a set of questions and a set of data that goes out beyond just us reporting it through NCI and using this for change. But that is something that's reported out to Medicaid, and I'll talk about that at the end. One thing that I'm not sure if everybody knows, I am also a person-centered thinking trainer. So to see that people report that their service coordinator knows what is important to that person, which was an increase too, it speaks a lot. It speaks a lot into how we're switching our mind from one year to the next on how we're approaching person-centered, what it looks like. understanding what's important to and what's important for, which can be a challenge for a lot of people when you are helping people prepare their plan. We do put a lot of our own wants and desires and thinks and needs, what we think people need. But the fact that we are showing that says that that we're changing the way we talk about person-centered. We change the way we are being person-centered. Staff having the right training to meet person's needs went down, which is an opportunity. People helping with their plan. We talked about that. Reviewing their plan annually, but we did see a lot of increase in these areas from one year to the next. So a couple of takeaways. People feel understood by their service coordinator, which is great. Technology discussions have increased, but we want to increase the use of technology. Service plans are more likely to reflect what's important because people do feel that the service coordinator knows exactly what's important to them. There was a decline in people feeling their staff is equipped with the skills to best support them. But again, that suggests a possible need for more focus, some change in how we develop the DSPs, how we develop management internally and externally, and how we measure competence. It's one thing to train, but you also have to ensure that people are competent, that they understand the information, and that they're comfortable with it. So health and safety. I will say that we did really, really well in being able to capture data in these areas. There were quite a few areas that we were unable to capture in 22, 23, but we were able to get in good numbers for that to be able to pair. Now, some areas in this section where we didn't get data from 22 to 23, we will be able to look at 23 to 24, 23, 24 to 24 and 25 next year to see how well we've done with it. Above the national average for people who have had a hearing test, slightly below the national average for people who report having a primary care. People who report having had a physical exam also went down. And could that be from responses, or could that be from data transparency, right? 50%, we're above the national average for colorectal cancer screening. We did not have a lot of data for our cancer to determine how many people that we support are actually getting their cancer screening. So this is going to be a big topic for next year's data. Again, want to make note, those larger numbers really are, and I'll give you an example. Anyway, if we are looking at the numbers for, say, the primary care physician, it went from 100 to 95%. The 100% was because there were only a few people who responded to that. And then there were way more people who responded to this question, or we were able to get more data for this question in 24. So I don't think, in my opinion, I don't think it's necessarily a decline in access all the way, but it might be something we want to look at. But I do think that there's that area for when we compare health and safety next year, when we get next year's data, it's gonna be different. I think we're gonna see a huge difference in how we've changed, just like the 30%, the 42%. All of those are really those numbers are high because of the amount of responses received in those areas. And then, like I said, in the cancer screening, we didn't have much data for 22, 23 to be validated to put in there, but we did for 23, 24, which does show that that's an improvement in, again, data transparency, how we're record keeping. Fewer people report being in poor health, and vaccine reports have declined. But again, I do think that is related to the amount of people who responded, and something up with the data, in the sense of, I don't know if that's a true negative, but still some opportunity zones in this area as well. All right. So the other survey we participate in is the adult family survey. That is the one that is mailed out to families directly. They fill it out. They can do it by hand and mail it back, or they can do it direct entry, which is through email. That one is the data from that comes from the direct feedback of the family supporting people in their home with intellectual and developmental disabilities, how they perceive the support. So the numbers may be a bit off based on the people who are actually receiving and the perspective of those who support them in their home. Above the national average, as you'll see, for family members who say their family members get all the services listed, that remains high from last year too, because like I said, last 22-23 showed us that a lot of people have access to stuff, but were they really satisfied with it? As you see, from the family's perspective, we're doing really well from access and delivery above the national average in those areas. In workforce, 13% saying their family members that there is turnover. That is not a negative, that is actually a positive, and that's gone down. 90% say they are always able to have staff available for support with their family, and support always has the right information and skills. But earlier, we talked about how people were reporting they don't feel like that their staff has less people reported that their staff have the knowledge and the skills best equipped to support them, but the families think that. So for information and planning, we see that, again, this is from the perspective of the families who are supporting those in their home with intellectual and developmental disabilities. Overall, are they satisfied with the services? Yes. All right. So always satisfied with the services, that is 64%, usually 26%, and the one that is 0, seldom or never. So that's a great thing, right? 95% of services and supports have made a positive difference in the life of their family member. We're above the national average, but 95% says a lot about how families are perceiving the services. And I know sometimes we're not always happy about how things may play out after you've requested something and what actually happens in practice. But to see that 95% of the families that submitted surveys, which we were about 171 valid surveys, 95% of them said that they believe that the services are making a positive difference. If you look at choice and control, we are above the national average in in all 3 places where families feel like they have the choice, so they're able to choose and support their family member in, say, changing their DSPs, changing the agency, having choice and decision over the agencies that they work with, and their service coordinator.
Angie?
Yes, ma'am.
Sorry to interrupt, but it looks like our interpreters are out of time, and I don't believe continue the public meeting without them. So we will make sure that the slide for this presentation gets posted to our website by next Wednesday, but we're going to have to go ahead and end today's session. I'm sorry.
No problem. No problem. If I'm gonna say, if there's anything I can say, I would like to say, if you do need me, call me to talk a little bit more about this if you are interested. And I'm open.
Okay, so I definitely apologize for keeping everyone over. Our next meeting is October the 24th at 2025. We will also be including with the uploads information on the electronic Social Security distribution guidance that DDS was sent. Unfortunately, we didn't have time to add that to the agenda today. So thank you, everyone, and have a safe and peaceful weekend. I'll see you on the 24th.